Hi, this is Dr. Biswaroop Roy Chowdhury, and for the first time in the history of medical science, there is good news for diabetes patient, and that is the new guideline, the launch of new guideline, which was launched by ACP, American College of Physicians, on 6th of March 2018. And if this guideline is implemented fully, then about 70% of the diabetes patient, the people who are taking medication currently, will be declared as non-diabetic. They will be off medicine. They will be called as a normal healthy population. What has been happening till now? Till now, even if the doctors see your blood sugar more than 100, say 101 mg per deciliter, they will insist that you must take medicine to reduce the blood sugar below 100. They will declare you as a pre-diabetic patient or a diabetes patient, and they will create a situation of fear around you, that if your blood sugar goes beyond 100 or 125 or 126, or somebody says 130, then it may lead to heart attack, it may lead to brain stroke, it may lead to kidney failure, blindness, etc., etc. But now the present new guideline is something opposite of that, and if I put this guideline in a simple term, it says that without the medication, even if you are able to maintain your blood sugar less than 250 mg per deciliter, that is wonderful blood sugar, and you need not to worry as a for blood sugar, or and you are not a diabetes patient at all. And this is something which I had been telling to my patient for last several years, and you can read in my books, especially the book Last Days of Diabetes, where I have proven with the help of the present evidence basis that if anyone is able to maintain a blood sugar less than 250 mg per deciliter, or less than 14 millimole, or something like that, 13.9 or 14 millimole, and then it is a wonderful blood sugar. And the second important thing which I have been telling to my patients since last several years, that by taking medication you may lower your blood sugar number, but that lowering blood sugar number do not or may not translate into equivalent good health. What happens when you take medication and lower the blood sugar number? That is something different. It is a different biochemistry then in comparison to when naturally you keep your blood sugar low or normal. And the definition of normal blood sugar, it has also changed after 6 March 2018, and that is something good news, as you can see on the screen, the new guideline. But let me explain this guideline for you in a simple term. Now the guideline is divided in 4 parts. The guideline 1, it says clinician should personalize goals of glycemic control based on the discussion of benefit and harm of pharmacotherapy, general health, and life expectancy. What it means? It means that before you are prescribed the medicine, you must be told about the medicine, you must be told about the side effect of the medicine, because it is seen in most of the cases, by taking medication, the blood sugar of the patient definitely it goes down, but at the cost of making the patient even more sick, and reducing the life expectancy, and reducing the healthy life time also. So this means, it says that for only very small population of the diabetes patient, the medicine can do any benefit, but for most of the people, by taking medication, they may reduce the blood sugar level, but that may not translate into longer life expectancy or healthier life. So that means less medication, better health. Now coming to guideline number 2, as you can see on the screen, it says aim to achieve HbA1c level between 7 to 8%, bracket 8.4%, because in one of the 5 very important trial, it was 8.4% rather than 8%. But normally when the guidelines are released, it is always released in whole number, so that the people can remember easily. So whole number is 8, but if you want to know in detail, in precision, then it in reality it is 8.4%. So if you are able to maintain a blood sugar level HbA1c between 7% to 8%, or less than 7% without any medication, then it is absolutely healthy. So this is in contrast with what you had been following. Till now, doctors had been advising you that you have to keep your HbA1c less than 5.6%, and that means more medication and more insulin. So what was happening? Because the advice of doctor, the people are trying to keep the blood sugar level, the HbA1c, less than 5.6%, and that means more medication and more side effect, more death. So here the HbA1c is relaxed. This means that if you with medication your HbA1c comes less than 7%, this means it is a time to reduce, taper down the medicine or to stop the medicine. And if without medicine your HbA1c goes more than 8.4%, this means only now you can benefit by taking a little bit of medication. This means without medicine, if somebody is having HbA1c more than 8.4%, only these number of patient, this population, this percentage of patient can benefit a little bit by introducing medicine in their lifestyle. Now the guideline number 3, as you can see on the screen, consider reducing the drug insulin if the patient achieve HbA1c less than 6.5%. It is very clear, it is an extension of guideline number 2 only, and it says that suppose you are taking diabetes medicine and you are taking insulin, and you see your HbA1c has come about 6%. This means you are harming yourself. It has come too low. This means you are taking more medication. This means that you have to stop the medication, you have to taper the insulin, and if you don't do it and you keep your HbA1c at 6% or 6.4% with the help of medicine, that means it is a compromise to health and it is reducing your life expectancy. Now coming to the guideline number 4, which is the most important one, as you can see on the screen, avoid targeting blood sugar level in the patient with chronic conditions like kidney disease, cancer, COPD, congestive heart failure. This means if the person is sick and old, then blood sugar number is not important at all. No need to check the blood sugar. Only thing is we have to give the patient comfort. And if there is some symptoms, that is frequent urination, one of the symptom, or a lot of weakness, and by taking medication, if the symptoms are relieved, only then the medicine should be given to the people who are suffering from life-threatening disease already, or the people who are old. I repeat, for old people and for people who are suffering from the complicated lifestyle disease like cancer, kidney disease, etc., as you can see on the screen, blood sugar number does not play much role. Predictability of health cannot be done with the basis of blood sugar number. For those patients, the medicine is required only if it can give some symptomatic relief. That means by taking medicine, surely the blood sugar level may go down, but that is not important at all. Important is if the patient is getting some comfort, only then they can consider giving the diabetes medicine. Now, while this new guideline is released, in India, especially the doctors of the corporate hospitals, they are protesting the new guidelines, and they are saying these guidelines is not based on the evidence. However, the truth is just the opposite. As you can see on the screen, this guideline is based on 5 important and very big trials: the ACCORD trial, the advanced trial, the UK-PDS 33, UK-PDS 34, and VADT, Veteran Affair Diabetic Trial 2015. So these are very large trial, and these 4 guidelines are based on these trial. On the contrary, the ADA guideline, which the doctors of India, of Indian Medical Association, have been following last 20 years, those guidelines are having no basis, no evidence. So as a diabetes specialist, it's my advice to follow the new guidelines, which I'd been telling to my patient in last several years already, but now it has been official. So now it is easy for you to accept it, because now it is backed up by something as big as ACP, American College of Physicians, which is the highest body, much higher than ADA, much higher than IMA, and it is one of the authentic organizations, and they work for the people, they work for the people's health. I hope this audio will help you to understand how to have a better control on your blood sugar. Thank you.